And guys, shifting gears here, Tusk Venture Partners, venture capital fund, investing in consumer technology startups operating in heavily regulated markets. They're leading a $10.5 million Series A funding round in Boulder, which is a fully digital treatment program supporting long-term recovery for opioid use with medication-based treatment. Joining us now to help us break this down and tell us more, Jordan Knopf, who is the managing partner at Tusk Venture Partners. Jordan, great to have you back.
Thanks for having me.
Absolutely. Okay. How is Boulder using a technological approach to opioid treatment?
So the traditional approach is leveraging basic brick and mortar facilities, which we know is highly ineffective. Actually, most people that come and check into a physical facility, the likelihood of them actually achieving lifelong adherence to being addiction-free is very, very low. The gold standard in treatment is using medication-assisted therapy. Really, at its core, the three problems that Boulder Cares is taking a unique approach to is by leveraging technology, specifically telemedicine, to break down stigma around the issue, to increase accessibility and increase affordability, so that people that are suffering from opioid addiction can get the care that they need.
Yeah, it's a tricky topic, right? Because we obviously want what's best for patients. And when you have a business like this that wants to, of course, help people recover, we want to make sure it's effective. So from what perspective is a digital form of treatment better, or accumulative to what's being treated from the drug perspective?
100%. So there's two components there that the first one I think we should unpack is probably from the cost perspective. So what's very unique about Boulder Care is not only are they the first fully digital platform, they're also the first that introduced a value-based care payment platform. So in essence, they're being compensated not on a fee-for-service model, which it basically has misaligned incentives and is one of the root causes why we are where we are with the healthcare system today, where it's compensating doctors for seeing patients on a volume basis. So the minute you walk out of that brick and mortar facility, you're no longer a revenue generator for that specific rehab clinic. With Boulder Care, they're being compensated based on outcomes. So based on metrics like the readmission rate to the emergency room. So if you don't show back up in the emergency room, or you are passing drug tests, that's what determines the rate that an insurance provider like Primera is going to be paying them on a monthly basis. So
Apple CEO Tim Cook once saying our greatest contribution will be about health from Apple's perspective. From the VC landscape, where do you view the opportunities in healthcare to really amount to better patient quality, better services that we're seeing out there, and more of a customization around a healthcare industry that has been so fragmented but needs to come together for the betterment of each person that needs to get some type of care in one capacity or another?
It's a great question. So I do think that telemedicine or digital health in general is where we're seeing a tremendous amount of opportunity, specifically from our seat and given our unique value proposition to founders that we're working with, to really help solve a very large problem that, the opioid epidemic really stemmed from a few core things: some aggressive marketing tactics by pharmaceutical companies, some over-regulation to counteract what was the beginning signs of a problem, and really a misaligned incentive structure. So I think that the telemedicine aspect really goes after the core of accessibility and affordability, because at the end of the day, 80% of the people that are impacted by the opioid epidemic cannot get access to the treatment that they need and that they deserve.
So the app is patient-facing, or is it hospital-provider-facing?
So it's both. So an initial onboarding is basically coming through. You're onboarded, patient-facing to a doctor. It's not just a prescribing doctor. I think that's the really important piece to understand about what we love about this platform and the vision of the founder is that the care doesn't end with just getting medication. It's, medication-assisted therapy is part of it, but it's also about coordinated care effort that doesn't end ever in the patient journey. It's the peer support that comes along with it, the behavioral health aspect of it, and being able to have access to those tools on demand via text or video, 24 hours a day, 7 days a week, is something that's never been offered before.
We've talked about how the Tusk Ventures portfolio includes companies that are in industries that are still lacking regulation in areas where they've invested heavily in research and development and are looking to expand the future of transportation in some cases, Uber being one of those cases. Within the healthcare industry particularly though, how might regulators be skeptical about prescribing drugs over video chat, and where do you kind of increase that conversation and awareness?
So that is the key. So that's where we believe there's been some over-regulation in the sense of this is the primary medication that's used to treat opioid addiction is a controlled substance. And so there is the notion that, okay, it needs to be governed accordingly, which it is. I think that telemedicine really plays a critical role in the sense that there are some antiquated practices that are being used where people want a face-to-face interaction to see people take a pill, which can be done over video, or to do a drug test to make sure that they're adhering to their regimen can be done doing a cheek swab over video chat instead of going to the doctor's office. It's something that really is bridging the gap where the primary areas that people are suffering in the US right now are in rural areas 65 miles away or more from a doctor. And being able to, most people can't go see that doctor 3 times a week. They have jobs. They need to put food on the table. And so you're really leveraging technology that's been around for a long time in a more a common sense approach to get people the help that they need.
Targeted as well and specific.
Absolutely.
Yeah. Jordan, thank you as always for being on with us. Jordan Knopf is a managing partner over at Tusk Venture Partners. Have a great weekend.
You too.
Thanks, Jordan.
Thanks.